skin. The next nerve is here, which is 32. That's going to be the musculocutaneous nerve, which innervates on the brachial nerves, or the brachial muscles for the flexors, and it also is going to innervate on the skin of the forearm. So 32 is musculocutaneous. We go one more medial, just medial to the musculocutaneous is going to be the median nerve, and that's going to travel all the way down the arm. And it's a little bit confusing here because the person's not in anatomical position, so it kind of twists. But as you can imagine, if this thumb was facing outward, it's going to travel along the radial portion. So 33 median nerve travels all the way down, and it's going to be the lateral portion of your flexors for your wrist, and it's also going to be the palmar surface. So here, near your thumb, on the palmar surface of the skin. Now next is, look, one more medial, 34, is going to be the, I guess that's going to be the ulnar nerve. And the ulnar nerve is going to travel, of course, along your ulnar bone. And that's going to, here it's going to go all the way across. But if you're standing anatomically, it's going to travel straight down along your ulnar. So, and that's going to be the flexors, as well as for the, I guess, the medial portion. So if you're standing anatomically, it's going to be the medial flexors, as well as the medial palmar surface. And the last nerve that we're going to look at here on the arm is going to be the radial nerve, which the radial nerve, like the axillary nerve, is going to travel posterior to the humerus. So the radial nerve, I believe, is 37. So radial nerve is here. So as you can see, it's kind of a dotted line. Yeah, 37. So, and that's going to innervate on the skin and the muscles of the posterior forearm. The next is we're going to look at is the, I guess, just going to look at the thoracic. There's no plexus in the thorax, as we all learned on the quiz. And these are just going to wrap around here. The next plexus that we're actually going to look at is going to be the thoracic, or the lumbar plexus. And looking here, the first thing we're going to look at is the number 53. So number 53 is going to be the obturator. So this, you can see, it's kind of small here, but it's going to travel down through the obturator foramen, and it's going to innervate the muscles and the skin of the inner portion of the thigh here. So the medial portion of the thigh. The next part of the lumbar plexus is going to be the number 56. So number 56 is a larger nerve. Look here, it travels medial as well as a little bit more anterior. And instead of traveling through the obturator foramen like the obturator, it can travel straight anterior. So it's also going to innervate some of the medial thigh muscles as well as the skin of the thigh. And also, if you follow it all the way down, it's going to turn to the saphenous nerve. And the saphenous nerve travels all the way on the medial portion of the leg, innervating the medial portion, medial muscles, or just the medial skin and foot of the leg. The next plexus we're going to look at here, it's kind of hard because it's going to be the posterior portion. Unlike here, it's anterior for the lumbar, the sacral plexus. So here you're going to have to kind of look past all these other nerves that we talked about. So sacral plexus is this portion here. And the first one that is going to break off is the gluteal nerve. And the gluteal nerve is going to innervate the muscles that we learned about that abduct as well as they're going to also extend the thigh. So those muscles it's not innervating the skin here. The next group here is going to be, so you're going to travel all the way down here, that's going to turn into the sciatic. So sacral turns into the, up here, the gluteal, as well as the sciatic nerve. So the sciatic nerve travels posterior, instead of traveling anterior like the femoral, it travels posterior to the humerus, or the femur. And so if you travel that down, it's going to also innervate the medial portion of the muscles and the posterior portion, so things like the hamstrings. And then this breaks off here into two nerves. The nerve here is going to be the tibial nerve. So the tibial nerve travels posterior to the tibia all the way down, innervating the muscles of the posterior leg, as well as it's the plantar surface of the foot, as well as the skin. And then up here, if you go lateral instead of straight down, it's going to break off into the peroneal, also known as the common fibular nerve. And this is going to innervate the lateral and anterior portion of the leg, as well as the dorsal portion of the foot. So tibial goes down to the plantar, and the femoral, the common fibular travels to the dorsal portion.